a bird, she needs to fly. Let all the hurt inside of you die.
You're frozen. You know the saying, freeze your buns off? You know that saying? It's taken on a whole new meaning right now. The FDA approving a high-tech weapon just this week in the battle of the bulge, freezing fat cells to help you lose weight. Joining me now to explain how that works is Dr. Scott Wells, a board-certified plastic surgeon. So, Doc, does it really work?
It seems to work very well. The new technology is based on the principle that if fat is frozen or chilled to a certain degree, it will undergo a cycle, ultimately leading to cellular death. And by applying the science very particularly, we are able to control the amount of fat reduction in specific areas and really get a patient a result.
So how does it work exactly? How does this machine, you just put, we're seeing, I guess, one picture on our screen right now, but you also see the other one we've had up about someone kind of sitting there and looks like there's a machine right at her hip. So talk us through how it actually goes down.
Well, there is sort of a belt-like device that is applied, and the bulge is actually sort of suctioned into an area where a controlled amount of cold is delivered, and this will actually, as I said, induce a cellular death.
Does that cause any sort of pain or discomfort to have your belly bulge frozen?
Most patients say for about 10 minutes it feels a little bit cold, but really not uncomfortably so, and after a few minutes they're quite comfortable.
What about the results?
The results are variable, as with all non-invasive techniques. They do not compare as well with traditional surgical techniques, but of course there is not the downtime, the bruising, and the swelling of traditional surgical techniques. There is some cost involved with the...
How much?
Typical treatments vary anywhere between $2,000 and $4,000. It's based on the fact that the research and development has been very high, and the cost of bringing these procedures to market have been high, and so the patient has to bear that cost.
So who would be a good candidate for something like this?
Best candidates are patients who do have a good lifestyle, eat well, exercise, but find they still have a very localized bulge, particularly in the midsection or perhaps the love handles, and really want to do a little bit more to spot reduce these areas.
You're going to have it at your practice?
I will.
You will? And you're just going to start using it as soon as you get it?
We're going to be integrating it by a customized approach to patients who are not candidates or do not want to have traditional liposuction, and we will be integrating it as part of our armamentarium.
You know, Doc, we're going to have a lot of our viewers, instead of going to the steam room, thinking they can go to the freezer instead. You can't do it yourself.
You shouldn't go into a freezer. It will not work the same.
Good to know, Doc. Thank you so much, Dr. Scott Wells. Appreciate it. And I guess it's one to watch, John. Freeze your fat.
I'll be taking a look at that, Jenna. Thank you.